Our research looks at the individual differences in risk perception and misperception of the COVID-19 pandemic. When the COVID-19 pandemic began, several studies investigated how political beliefs and the personality traits impacted understanding risk and information of COVID-19. However, very few studies emphasize the importance of cognitive differences in perception of risk and susceptibility to misinformation. Impulsivity, numeracy, and cognitive reflectiveness all play a role in risk assessment, but the results of their importance for COVID-19 risk assessment remains unclear. In our study, we investigated the importance of these cognitive variables alongside political affiliation and the presence of a risk factor when assessing risk and misinformation of COVID-19.
442 undergraduate students from Miami University and Washington College participated in our research. Given a list from the CDC, 19% of them reported having a risk factor that could increase the chance of COVID-related complications. Participants also identified their political affiliation, with 44% as liberal, 28% as moderate, and 23% as conservative. The Qualtrics survey began with individual differences measures. We used the subjective numeracy scale to measure numeracy, which asked participants 8 questions such as, how good are you at working with fractions on a scale of 1 to 6? To measure impulsivity, participants completed the Barrett Impulsivity Scale. This involved participants rating 30 self-report prompts, such as, I plan tasks very carefully, on a 1 to 4 Likert scale. Participants took the 7-item cognitive reflection test to measure cognitive reflection. Each item of the questionnaire had an intuitive but incorrect answer and a less intuitive but correct answer that required deeper cognitive thinking. For example, a bat and a ball cost $1.10 in total. The bat costs $1 more than the ball. How much does the ball cost? While you may intuitively think that the ball costs 10 cents, the ball actually costs 5 cents because the bat and the ball together have to equal $1.10. So if the ball is 5 cents, $1 more than 5 cents is $1.05. So the total number is $1.10. We had 3 dependent variables on participants' understanding of COVID-19. Participants first estimated their general perceived risk with 7 items on a 1 to 100 sliding scale. Example prompts were hospitalization, spreading to friends or family members, or dying. For acceptable risk, participants estimated the maximum risk of infection for 9 specific activities, like eating at a restaurant or going to the gym, also on a 1 to 100 scale. And the numbers on the scale indicated the maximum percentage of infection risk that a participant would consider acceptable in order to complete the activity. And finally, participants rated 21 common COVID-19 misperceptions as either true or false. Misperceptions were statements like, the coronavirus was created in a lab.
So looking at our results, you can see our first dependent variable of perceived risk actually didn't relate to any of our individual differences measures, but we did see significant differences in political affiliation and in personal risk factors. So first, looking at the graph over here, you can see that there was a significant difference between liberal and conservative participants in terms of their perceived risk of coronavirus infection, with conservative participants having significantly lower levels of perceived risk. Looking at the table on the right, you can see that there were significant differences between participants who had a risk factor for complications surrounding the coronavirus and participants who didn't. In particular, we see that the first 4 different perceived risks were significantly higher for participants who had a risk factor. So that's risk of infection, risk of hospitalization, risk of dying from the coronavirus, and risk of serious long-term complications. Now, these bottom three make a lot of sense because they would, in fact, be higher for participants with a risk factor. But the risk of infection doesn't make as much sense because you wouldn't anticipate that participants with a risk factor would be more likely to get infected. What we think might be going on here is realizing you have a personalized risk might make the coronavirus risks just generally more scary and more looming. So you might think of the risk of infection as being a bigger deal now. Looking at our second dependent variable of acceptable risk, we see that cognitive reflection scores actually predicted lower levels of acceptable risk, meaning that participants who are better able to navigate through those bat and ball problems tend to be more risk averse. So participants who are more reflective, they're more analytic in their thinking style, are less likely to accept risks to go grocery shopping or to go to the gym. However, we didn't see that there was a significant effect of subjective numeracy or impulsivity. Once again, though, we saw that political affiliation played a significant role, with conservative participants having significantly higher acceptable risk estimates compared to liberal participants. Combining this with our previous graph, you can see a kind of problematic trend where conservative participants view risks as lower, but are more willing to accept risks. So you can see how these might work together to produce some unhealthy behaviors that are more risk-taking. Lastly, looking at perceptions or misperceptions, we have a significant effect of cognitive reflectiveness again, suggesting that participants who are more reflective tend to be better able to navigate a lot of the misinformation. They're less able or less willing to endorse misperceptions. Similarly, we see an effect of impulsivity, where participants who are less impulsive tend to be better able to navigate that information as well, so they endorse fewer misperceptions. However, just like in our other variables, numeracy didn't seem to play much of a role. And again, like in our other variables, we see that political affiliation plays a significant role, with conservative participants endorsing significantly more misperceptions than liberal participants.
So in our conclusion, we first see that having a personal risk factor does increase one's risk estimates for various coronavirus related risks, like hospitalization or any other health complications. This makes sense, being that having a personalized story caused by the pandemic or another health related issue tend to have more of an impactful meaning rather than making judgments solely on statistics or society level information. Tying this idea back to a participant showed that it did increase their risk estimates. We also saw a strong impact of politics. Conservative participants were lower in the risk estimates and higher in the risk acceptability and endorsement of misinformation. This does reflect on what we are seeing in the current state of politics in the United States. Next, we see that cognitive reflection scores from the CRT test had a significant impact on risk acceptability and misperception. This makes a lot of sense, being that the literature in our research emphasizes the importance of analytical and reflective thinking on navigating very complex pieces of information and even navigating misinformation. This is very significant due to the increase of misinformation during the pandemic. Impulsivity, though it was related to misperceptions, it wasn't really related to risk itself. What we believe is going on here is that impulsivity tends to relate mostly to risk in straightforward scenarios. For example, we can compare the risk of dealing with drugs and alcohol and more impulsive personality traits. They tend to relate more to risk-taking behaviors due to a clear risk-taking experience, like partaking in something potentially harmful. But in situations where the risk is less clear or less straightforward, then impulsivity doesn't relate as easily. We think due to so much misinformation about the current pandemic, most people are unsure of the actual risk they were taking, especially in the beginning of the pandemic. Like, is it going to kill you? Is it airborne? Is it the flu? And we didn't know. So impulsivity wasn't clearly related. And then lastly, we believe that numeracy wasn't clearly related to any of our dependent variables or measures. And this might be due to the specific numeracy scale which we chose. The specific numeracy scale we chose was the subjective numeracy scale. This specific scale is short and subjective and self-reporting. We believe that this scale was possibly too short and too subjective. It would be interesting to see if we could find a relationship between more objective numeracy scales, risk perception, and misinformation surrounding the coronavirus. Being that we do know numeracy is very important for medical judgment and decision making. In general, we think that this is a good first step towards understanding more of the cognitive abilities and individual differences that can lead to understanding risk, acceptability of risk, and understanding misinformation. We believe a lot more can be expanded on what we have started here.